Disclosures. So robots are an area of advancement in spine surgery, an important area of advancement in spine surgery. Using one company's popular robot system as an example, the first generation was introduced in 2004, and since then there have been many updates, such as improvements in navigation and image recognition technology. Reports of these newest upgrades have been promising, with several studies demonstrating acceptable rates of pedicle screw accuracy. So the purpose of our study was to evaluate whether there was an improvement in the rate of complications using these newest generations of robots. Sorry, the screen went out here. So we retrospectively reviewed all surgeries at a single center using one company's newest generation robot. So we had 268 patients undergo robotic-assisted spine surgery, a nearly 50-50 split using an open and minimally invasive approach, and on average, patients received about 9 robotic screws. So 6 patients suffered robot-related complications. There were 3 that had nerve root injuries from misplaced screws, all requiring reoperations. We had 1 patient suffer a motor deficit from the from the tap hitting the nerve root, also requiring a reoperation. Another patient had a durotomy from a misplaced screw that required intraoperative repair. And there was 1 patient who had a nerve root injury from the drill. So here's an example of one of our patients. He presented with leg numbness and 3 out of 5 leg weakness, and was found to have a medial breach of the spinal canal at L4. However, symptoms did resolve after removal of the screw. Here's another patient. In this case, both screws shifted towards one side by about 10 millimeters. We think it's because the pelvic reference frame was too far from T10, so there was some movement that was not detected over that distance. Here's another patient that we think had a problem with the reference frame, as both screws were shifted similar distances in the same direction. This patient presented with back pain and new 1 out of 5 leg weakness after the surgery. The attending surgeon believes that the tap wraps the L1 and L2 nerve roots, causing damage that did not improve even after removal of the screws. This is a patient who had a grade 4 spondyate L5 S1. When the S1 L5 transdiscal screws were placed, L5 was pushed away relative to the pelvic reference frame, and we think this caused the drill to go in the wrong place. This caused an immediate spike in the EMGs. The patient's leg kicked, and she suffered a burning sensation in her dorsal foot for about 3 months. So in total, there were 4 patients that required reoperations for misplaced pedicle screws to fix a total of 10 screws. Initial reports suggested that no misplaced screws required revisions, but most of the bigger series came somewhere close to our reoperation rate of 1.5%. So it is notable that despite newer technology, that this reoperation rate isn't necessarily improving. One shortcoming of our study, due in part to its retrospective design, is that all robot-related complications may not have been captured. So for example, if a misplaced screw is intraoperatively revised without any complication, it may not necessarily be reported, and it may not make it into our data. So in conclusion, there remains a significant rate of robot-related complications despite using the newest generation of robots. So we have to keep thinking of preventing harm to future patients. When putting this study together, Dr. Skaggs had reached out to several centers that had known robot-related complications, but were unwilling to contribute to this study. So when we balance what's best for the patients versus what's best for the surgeon, we should hopefully have centers contribute to studies like this. And at Cedars, we're actively trying to collaborate with at least 5 other centers in an anonymous fashion to compile all these robot-related complications so we can all learn and progress. So if this could be of interest to you, let's please talk today. Thank you.